Hi, I'm here today to talk with you about pregnancy choices. We're going to be talking about pregnancy choices in this video. Just a subject flag, it is a sensitive topic and there'll be references in this presentation about sex, adoption and abortion. My name's Mel Gadd and I'm a sex educator with Come the Others Crew Sex Education Company. So why are we talking about pregnancy choices today? Well, if you have a uterus and have penis and vagina sex, you could become pregnant. According to the NHS, if you're under 40 years old and have regular sex without using contraception or a condom, there is an 8 in 10 chance you will get pregnant within 1 year. So how do I prevent unintended pregnancy? Well, unintended and unwanted pregnancy can be prevented by using a range of contraceptive methods. So find something that suits you and your partner. Or you could use condoms, or you could avoid penis in vagina sex. There are 14 different contraceptive methods available currently, both hormonal and non-hormonal, and these include long-acting reversible contraceptives, which reduce user failure, and contraceptives which you have daily control over. You can access these via local sexual health services or via your GP. Just some general safety about having sex. Who are you with and who knows where you are? What can you do if you don't feel safe? You need to communicate your boundaries about what you want and don't want to do, and check in that your partner feels safe too. Remember that consent is the most important thing in relationships and sex. What you do is your choice, but it's also the other person or other people's choice too. Be sure that all parties who are having sex together are fully consenting to everything you do together. Absence of a no is not a yes. And remember, people cannot legally consent to sexual activity when alcohol or drugs have inhibited their choice making, if they're asleep, unconscious, or if they're forced or tricked into having sex. So it's the morning after. What can you do if you've had penis in vagina sex without using contraception or a condom? Well, you can access emergency contraception. You can access emergency contraceptive pills from a pharmacy, and the sooner you take this, the more likely it is to work. So the levonorgestrel pill can be taken within 72 hours of penis in vagina sex, and the ulifristal acetate pill can be taken within 120 hours after penis in vagina sex. But as I said, the sooner you take these, the better it is. You can also access a copper intrauterine device, an IUD, from a sexual health service. This is a copper coil that's inserted into the uterus up to 5 days after penis in vagina sex and is currently the most effective form of emergency contraception. I think I might be pregnant. What can I do? Well, first of all, take a pregnancy test. You can carry out most pregnancy tests from the first day of a missed period. If you're not sure when your next period is due, do the test at least 21 days after you've last had unprotected sex. The Student Union has free pregnancy tests available in their accessible toilet. You can buy pregnancy tests from pharmacies and supermarkets, but you don't need to buy an expensive test. And if you test too early, you may get a false negative result. If it is negative and you're not sure, take a test again a few days later. So your test is positive, so what can you do? Well, first of all, please don't panic. There is always support available when we have emergencies. You can talk through your options and decision making. You can get support from the Student Wellbeing Service, and you can also access pregnancy counselling from the BPAS, and their details are here. You have some options if you're pregnant. You can continue with the pregnancy and have the baby. You can continue with the pregnancy, have the baby and have it adopted, and you can have an abortion, and this is sometimes called a termination. Whatever you decide, it is your decision. So what next? If you wish to continue with the pregnancy, it's best to access healthcare as soon as possible. To do this, contact your GP for an appointment with a specialist pregnancy nurse, also known as midwife. You can also talk with your GP or midwife if you're considering adoption for the baby. If you're pregnant and do not wish to continue with the pregnancy and would like to request an abortion, you can access this service via the British Pregnancy Advisory Service, also known as BPAS. So what are your abortion options? Well, there are two main types of abortion treatment. You can access a medical abortion or a surgical abortion. If you are under 10 weeks pregnant, you can have a medical abortion, which is taking a pill at home to cause an early miscarriage. Between 10 and 24 weeks, you can have a pill to push out the pregnancy, and this involves supervision and 2 clinic visits. With surgical abortions, so under 14 weeks, you have a vacuum aspiration at the clinic to remove the pregnancy. This is done with sedation and it's done as a day visitor. And then between 15 and 24 weeks, it is done at a clinic and you have a dilation and aspiration under general anaesthetic to remove the pregnancy. This is also done as a day visitor. You can access pregnancy tests, external and internal condoms, DAMS lube and STI test and post kits for free from the Student Centre in the Students' Union and the accessible toilet in the Students' Union. And you can also access the Student Wellbeing Service, and the QR code here takes you to their website. Your local sexual health service, BCUHB Sexual Health Service, has lots of services around sexual health that can support you, and they're easy access, they're friendly and non-judgmental, they're free, they offer STI testing and treatment, contraception services and HIV services. Public Health Wales have a range of services for people who are living in Wales, and you can access their services online. So they have free postal condoms, you can order tests and posts STI screening to come in the post to you, and they have a range of sexual health information on their website, including information about pregnancy choices. This is one of a series of video presentations on relationships and sexual health topics commissioned by Undeb Banga. They were designed and delivered by Cwmni Addysg Cru Sex Education Company. Goodbye.